I'm Lisa Pickering, and welcome to CITV's Press Talk. Here's the most recent news and information from the government of Bermuda.
Good afternoon. Thank you all. I'm pleased to be here. I did have 8 or 10 pages, but John Barrett, your chairman, reminded me that the longer I take, the longer it takes before we get to eat. So I'll make sure that we cut it down to 3 or 4. Good afternoon, everyone. It's a real pleasure to be here today to celebrate the Bermuda Housing Trust for all the wonderful work that they do for affordable seniors housing and to celebrate you, our seniors. In one recent poll, Bermuda was declared the most expensive place to live in the world. Imagine what that means to seniors who are living on fixed income. Affordable housing is one of our seniors' most critical assets, and it's critically important. For over 50 years, the Bermuda Housing Trust has provided just that, enabling about 200 seniors to have the security of knowing they have a home and that the rent for that home will be reasonable. Not only that, BHT seniors have the advantage of living and socializing in a community setting. This is very important for good physical and mental health. From the ministry's point of view, the Bermuda Housing Trust's ongoing commitment to provide affordable housing to seniors is vitally important. It's vitally important because it means government does not have to provide housing for those living independently on Bermuda Housing Trust premises. Government simply cannot do everything. And the Bermuda Housing Trust, or BHT, is truly a most valued partner of the Ministry of Health and Seniors. BHT's affordable housing for seniors who can live independently frees the Ministry of Health and Seniors to concentrate on solutions for those who cannot live independently, those who need long-term care. Seniors are valued, and we're putting long-term care at the forefront of what we are doing. You'll be up on the news, so you know that at King Edward VII Memorial Hospital, it is absolutely full. There are no extra beds. More needs to be done to move seniors from the acute care hospital to a place where they can be cared for safely, either at home or in another residential setting. And I must stress something here because I know that this is an independent living facility, but for me, the way that your facility can help and the way that we can do something is to make sure that all of you live at home, live well. We want to make sure that you do things that keep you healthy. So that's why my ministry is always trying to get information out there about eating better, eating healthy meals, exercise, because the more that you stay at home and healthy, not only do you stay here, but you don't go into hospital, and therefore you help us to make sure that the situation doesn't deteriorate. As important as anything that we do, we need to make sure, as I said, that nobody ends up in the hospital unnecessarily in the first place. We must ensure that we take good care of ourselves before problems get so bad that the only solution is the hospital. An ounce of prevention is worth a pound of cure. But of course, it's not just about prevention. We recognize that Bermuda's population is aging, and this is putting added stress on all of our health care and long-term care resources. Conditions like dementia and Alzheimer's are affecting more and more people, and many countries are struggling to cope. Bermuda is not alone. We have an aging population with few options for residential long-term care. In the community, we just have 22 residential rest homes and nursing homes and 396 beds. In addition, Bermuda's Hospital Board maintains a further 259 long-stay and group home beds. We're working on a solution to this difficult problem. The ministry is moving forward with the Long-Term Care Action Plan, and as promised in the throne speech, we're working with stakeholders to find incentives to promote investment in additional residential care homes, which we desperately need as our population continues to age. Just as important, we're working to develop ways to ensure that seniors can either make modifications to their homes or receive care at their home, which will allow them to age in place, to remain at home for as long as possible. Perhaps not of interest to seniors living independently at BHT's homes, but of interest to others that you know, is the Future Care and HIP program called the Personal Home Care Benefit. This benefit allows those who qualify to receive personal home care in their own homes. The ministry is trying to keep people in their own homes for as long as possible, where it is more comfortable and familiar. This will reduce the overall number of residential care spaces required by our population. It is essential that we have affordable and accessible mix of housing options for seniors. Senior-owned housing, independent living, and assisted living facilities, and for those who are no longer able to live alone, we need to make sure that the right number of high-quality, appropriately staffed residential care places are ready to be occupied. In short, we're looking for how to make it more financially affordable for seniors to be cared and housed. The ministry is very grateful for the role that BHT plays. We should also commend the founding philanthropists, Mr. William Purvis and also Mr. Rod Ferguson, for their roles in recognizing and funding a need so many years ago that has done so much for seniors over the years. I would also like to thank the current board and board members of the past who have preserved the legacy. Thank you also to our seniors of the future who are serving us today, and thank you for inviting me. Enjoy your tea.
You've been watching Press Talk right here on CITV. Join us next time for your government's news and information. I'm Lisa Pickering.